name is Elijah Avila. I'm in EMT class 169, and this is my patient trauma assessment for my proctor exam practice. So first thing I would do for my trauma patient right here is I would put on my proper PPE, and I'm going to ask my proctor, is my scene safe?
Yes.
And what's my mechanism of injury or nature of illness?
3-vehicle traffic collision. This was the middle party.
Okay, and how many patients do I have?
Just one.
Okay, because it's a multiple car crash, I'm going to call additional ALS since I'm the first one on scene. And I'm going to go up to my patient. Since it's a trauma, I'm going to do stabilization of the C-spine. And what's my general impression of my patient?
He's non-responsive.
Non-responsive. Are there any lacerations?
There's a few lacerations.
Okay, and how's my breathing for my patient?
Minimal.
Minimal, okay. And is there any discoloration in my patient, or is his coloring normal? Can I see any obvious blood trauma, like blood leaking on the side?
Yes, to the right side of his rib cage.
Okay, so what I would do is I would immediately load him up into the truck, and I'm gonna perform my secondary assessment and baseline vital signs there inside the truck. And what I would do first is go to the head. Okay, are there any lacerations, broken jaws, nose on the head?
Possibly a broken jaw.
Broken jaw. Okay, is there any spinal fluid coming out of his ears?
Possibly. I didn't see.
Okay. And so I'd go right there. So is there anything on the back of the neck right here? Any like I can feel any like crunching or anything?
Yeah, maybe. I just didn't turn around.
Okay. Is there anything in the chest as I'm palpating? I look over. As I look at it, is there any lacerations on the chest?
No.
Just the side one on the rib?
Yes.
Okay, and I'm feeling the chest. Is there any? Can I feel any cracks or bumps or anything on the chest or the abdomen?
No, just to the right side of the
Okay.
rib cage.
And then I'm gonna go down to the pelvic area. Is there any cracking in the pelvic area? Is it broken?
No.
Does he have an erectile on his penis?
No.
Okay. And what about the legs? Is there any brokenness on the legs, the femur, the shin?
No, not that I
Okay.
see.
What about the other leg?
There's a laceration to the left side calf.
Okay. And is there any major bleeding to it?
No, doesn't seem that way.
Okay. And then I'm gonna do the capillary refill. Is there good capillary refill in his right foot?
Looks like it, yes.
Okay. And what about the left foot as well?
Yes, looks like
Okay.
it.
And when I brush my finger up his foot, is there any? Does he crunch his toes, or does it just stay the same?
He's crutching, like he's reacting to it.
Okay. And what about the arms? Are there any lacerations, any broken bones on the arm?
No, just minimal scratching.
Okay. And do they react to my hand crunch when I go like that to the hand? Do they crunch it?
Yeah, they react.
And what about the other arm?
Same, they're reacting.
Okay, so I'm gonna flip my patient over. I'm palpating their back and their buttocks. Is there any cracking on their spine or anything, or is it just stable?
It's stable, just to the upper portion of their spine.
Upper portion, like where the neck area is?
Yes.
Okay, so what I'm gonna do to take care, I remember that he had a broken jaw, so I'll go ahead and I'll dress that. I'll put a C-spine because you said that his neck was kind of broken. And then I'll dress the right side laceration. I'll dress that and make sure that no air has gone in. And then for the laceration on the right leg, I'll dress that one as well because you said there's no really broken bone, just lacerations, he's unconscious. This patient is a high priority patient because of the neck injury that could lead to death. And what I would explain to my EMS provider is that my patient is a young male who suffered a car accident, a 3-collision car accident, and he was a middle car. He was ejected and I found him on the street unconscious. He has a broken jaw, a broken neck, still alive. He has a huge laceration on the side where his rib is. I dressed that. No other, and then another laceration to his right leg, which I dressed that as well. He's unresponsive, but that's all I've really done for the patient. Is that it?